2, 1. Professor Martin Green, Chief Executive of Care England. Welcome back to the Care Home Show.
Thanks, Simon.
So it's good to see you again. So the world doesn't seem to be any less strange than when we last spoke, although maybe strange in a slightly different way. Tell me, what does the world look like from where you're sitting?
Well, I think the situation has stabilised a bit, but I still think there are some really big issues for social care. They're about now testing particularly. So we were promised testing for staff every week, and we were promised testing for residents every 28 days, and that hasn't materialised in all areas. And so this is a big impediment to things like, for example, the re-establishment of visiting. There's also another challenge, which is that people with learning disabilities have been a bit left out of this agenda, and so they haven't had the same access to testing that other parts of the sector have had. So I think what I would say is that testing is probably the foundation of a lot of things, and until that starts to work effectively, we won't be able to move to something much more like normal. Of course, there's been another challenge, which is about occupancy levels. So the issue has been that we have lost many people tragically throughout this pandemic, but we haven't seen people returning to fill their places. So this has produced a significant drop in income for care providers at the same time that they've had huge expenses on things like PPE and staffing. Now, the government did do some really quite amazing things in terms of allocating 3.2 billion, but sadly they allocated it through local authorities, so it didn't reach the front line. And then, of course, they developed the Infection Control Fund, and I think Helen Whately needs great credit for tenaciously fighting for that. But unfortunately as well, that has been administered through local authorities. So even when that's got to the front line, there's been huge administrative burdens in order to get that money. So I would say there are now different issues in play, but they're still very significant ones for the care sector.
Yeah, there's definitely plenty to think about. It's almost like you've got the financial pressures of lower occupancy and higher costs. You've got the additional administrative responsibility of administering testing, being doubling down on infection control, just all of the other things. Basically, the thing that I just keep on hearing is that things, to your point, people feel more comfortable around what's going on because they've accumulated experience, they've worked out how not to do things, they've worked out opportunities and ways of doing things better, but there's still an immense amount of pressure on providers and operators around the country.
Indeed. And I think, we shouldn't underestimate the huge pressure that is still on providers and particularly on staff. And this has been an incredibly emotionally and physically draining time. And lots of members of staff have had the challenge of trying to support people at end of life when they haven't been able to have their families with them. So we've not only been supporting the people themselves, but we've also had to support families. So I think, the emotional and physical toll that this has had on care workers has been absolutely huge, and we should not underestimate that, and we must make sure that it's acknowledged in the future.
I think that's one thing that I know that you and I have talked about in the past, but there's going to be three big costs of COVID, and that's going to be the human cost, the economic cost, but the mental health cost. I'm very conscious of it myself, and with the interactions that I have with people, just trying to learn what other people have been doing to try and energize and empower their teams in what has been such a tumultuous set of circumstances. And I think what's really good to hear is the ideas, the creativity, the innovation, just little things, little ways to be able to help people to not feel de-energized and deflated, because it's been crazy. It's literally been so intense for so many people. These absolutely heroic the care workforce have been absolutely unbelievable, but there's people, we're talking about humans here, and humans do have a finite amount of energy before they start to burn out. And I think, it's something that we all need to be conscious of.
Yeah, I absolutely agree.
So I know that Care England, well, you're always a busy chap, Martin. I can imagine this is probably just about as busy as it gets for you. Tell me, what have you and Care England been focusing on for the last few months?
Well, we've been focusing on, first of all, getting information that's simple and clear to our members. One of the problems has been throughout this pandemic that there's been a huge amount of information coming out of various government quangos. Some of this information has been very difficult to digest. Some of it has been constantly changing. And we've made it our policy to say we've got to be here to make that usable information for our provider sector and for our members. We've, throughout the pandemic and the start of it, for about the first 15 weeks, we were giving 7-day-a-week bulletins to members. We're now down to 6-day-a-weeks, but we're conscious that we have to keep very much in contact with members, not only to give them information, but also to hear what issues are coming up for them. Mm-hmm. At the moment, the issues that are coming up for them are testing, which is a major one, and how to get some consistency in testing. We were promised a range of things from government relating to testing, like, for example, weekly testing for staff, like 28-day testing for residents, also the capacity to test for visitors who might be seen as, in effect, like a member of staff because they were coming in to the care service. But a lot of that has not happened, and a lot of the commitments that were made on testing have not been honoured. So what we've been doing is acting as a conduit between our members and the government to identify where there have been issues and trying to unblock some of that. We've also been talking to government about the huge economic cost that COVID has brought to the care sector. So, for example, we've seen occupancy levels dip, but we've also seen significant increases in the cost base. One of the things that has really come out in the last few weeks is the fact that insurance premiums have started to skyrocket in the post-COVID era. And in fact, we had one of our members who'd had an 880% increase in their insurance policy. And in fact, the new policy did not even cover COVID-related issues. So what we were seeing was huge increases in the policy costs, but some of the things that you would want it to be covered weren't being covered. Now, what we did there was we have some good links to some of the insurance industry leaders. So we've been talking to them about how we make sure that there is insurance available for the care sector at a reasonable cost. But again, this is something where, because it's risk-based, there are going to be some significant increases. So we've been talking to the government about whether they must underwrite some of the insurance costs in the interim until we get back to something more like normal. So we've been doing quite a lot on that funding piece. We've also been doing quite a lot on staffing. You know, you were so right, Simon, when you said that the staff have been absolutely magnificent during this pandemic, but there is a cost when they have been working so incredibly hard. There's an emotional cost as well as a physical cost. So one of the things that we've been doing is trying to get the government to acknowledge that in tangible ways. I know lots of employers have been, and there have been ways in which employers have really striven to support their staff at this really difficult time and appreciate them. And I think it's really important that we appreciate everybody in the team. You know, social care is a team activity. No one person can do it all. And also, I want to make a plea as well, not only for the support to the care staff, but also to those magnificent staff who've been involved in catering and cleaning and some of the ancillary and support roles, because they have played equally a vital role in maintaining services. So I think we also have to acknowledge there are some challenges. We have to think about ways in which staff can be supported. But we also have to use this as a platform going forward to say, how are we going to, in the future, make sure that staff are seen as professionals, because that's exactly what they are, clear professionals. They proved it during this pandemic. We need some career pathways. We need some skills and competencies frameworks. We need some really clear qualifications and career escalators. And above all, we need to pay staff properly for the complex work they do. We need to have a funding regime that enables people to be paid in a similar way to the staff in the NHS. And that needs to be one of the platforms going forward. And that's one of the things that Care England is going to be really vociferous in advocating for in the future.
Yeah, definitely. I mean, as we record this, it's Professional Care Workers Week. Obviously, this will be coming out the week after, but there's obviously a massive push, particularly from the Care Workers charity on this. But I know that this is something that you're working really hard on as well. I know that you've got, so a lot of this is discussions with the government and helping them to understand what the kind of the state of play is, if you like. I know that you've got ministerial contacts at the highest levels within the government. What type of conversations are you having at the moment?
Well, we're having conversations which are increasingly, I think, about areas where there are problems. And I think one of the things we've got to do is we've got to identify where those problems are and then challenge government to find solutions to them. I think one of the things I would say, though, is that the government is in listening mode, and that's useful. I also think it's been really helpful since the new opposition team came into post. I mean, they've been in great contact with the care sector, and I think what we're seeing is politicians that are prepared to listen to what the issues are, and hopefully we'll see resolutions to them. I think the government ultimately has the responsibility for delivery, and I think the opposition plays a really useful role in highlighting some of the issues, as does, of course, the media. So some of our conversations have been with government behind closed doors in order to try and get them to act. But when those conversations haven't been successful, then we have used the media to give some grit to the oyster in our argument.
Got you. Yeah, and I guess that's the way that the message has to be reinforced. It has to be done really quite assertively to get the message across ultimately.
Yeah, I think so. And but I would always say what we try to do at Care England is craft solutions. I'm not into posturing. What I want is to have a conversation that leads to a problem being solved. And that will be my position of first resort. But of course, if those conversations don't deliver the response that's required, then we have to go into other conversations and we have to get much more assertive about what the issues are and also offer a clear roadmap on how to solve them.
Yeah, this is very much a time to be focusing on solutions and not the problems. We all know what the problems are, but yeah, it's the, as we've said many times, if not now, when. So, how do you feel about the government, how they're dealing with the kind of ever-changing landscape on a kind of more general basis, and then also specifically to the social care world?
Well, I think one of the things I would say is I think the performance of the government during COVID has been like the curate's egg, good in parts and other areas where they need to improve. I mean, I think some of the things the Chancellor brought in to try and protect the economy were absolutely amazing, and, you know, all credit due to him. Of course, we'll all be paying for that for a generation. But having said that, it was something that hopefully will make sure that the economic damage is not quite as bad as it could have been. In relation to some of the social care stuff, though, I do think that the government has sometimes been a bit behind the curve. But I also want to defend the government a little, because some of the quangos that they rely on for giving them their information have been less than good in this crisis. So, for example, the ONS delivered figures that were only about hospital deaths. And then when they finally started to deliver figures about community deaths, there was a point where the death toll, according to the ONS, was 217. In actual fact, I knew that at that point it was 7,000, but the ONS figures were 12 days out of date. Now, if I was the Secretary of State and I'd been given the ONS figures, I'd think to myself, there are over 450,000 people in care and only 217 have died. Tragic though that is, I would say to myself, I haven't got a problem. But 12 days later, he gets figures that tell him 8,500 people have died, and then he knows there's a problem. So I do not understand how, in a digital age, we couldn't have had more up-to-date figures. Similarly, when we were required to have figures, the Care Quality Commission came forward and said that they could help with the delivery of figures. Well, the question I want to ask is, why weren't they doing that from the start of the pandemic? And at every point we have seen, you know, organisations like Care Quality Commission, like ONS, Public Health England, who came very late to the party, who didn't understand what guidance they were issuing, and some of it was completely and utterly ridiculous, and in some cases was changed 6 times in the space of 48 hours. these quangos are quite clearly showing themselves to be not fit for purpose, both culturally and in the way in which they deliver a speedy response. Now, I think there's a real problem in terms of the cultures in those organisations. They're so focused on process and the whole issue of administration that they don't realise in a crisis you've got to be really nimble and you've got to deliver things that are effective and also delivered in a timely way. So I think one of the things that's come out of this is we need a root and branch review of these quangos. We need to re-establish what they're for. We need to look at why they couldn't deliver in a crisis. We need to look at their cultures as well as their structure. And I was a bit disappointed that the knee-jerk reaction of government around Public Health England was to announce this structural change. Well, actually what they've done is they've taken all the people who were the problem and they've just put them in the new organisation with a new head. Well, my view is that you need to look very clearly at what cultural factors are in play, and we need to change culture if we're going to change performance. And I don't think that's been acknowledged or done nearly enough. I also think there will be a time for a sober reflection on this, but it's not now. You know, as much as I criticised Public Health England, I don't think I would have rearranged the deck chairs on the Titanic just as it is in the middle of the storm. So I think we should think much more clearly about taking a longer term view. We should reflect on what happened. We should reflect on performance of organisations. We should identify whether they were cultural problems or structural problems. Then we should set a new vision for what we need in the best and the worst of times from the quangos surrounding social care.
Interesting that you bring up culture. If I'm not sorely mistaken, I think I'm sure that the CQC have actually taken some consultation around their culture. I'm sure they've been looking to try and get like some type of advisory panel or something like that. So that it appears that there's an admission that they have a problem. It doesn't seem that they're doing anything particularly about it at the moment, which again, that's probably true of many quangos, unfortunately. But yeah, it's not a surprise that, well, I don't feel surprised that we're in the set of circumstances that we're in, given what we've seen in the past. I guess that's what I'm kind of alluding to. So,
yeah, I would agree with that. And I think, you know, the CQC are about to deliver something which is about open cultures. And I would say to them, I hope that they have reviewed their own against the backdrop of what they're going to implement in the sector. Because when you sit in judgment over others, you have to be like Caesar's wife. You have to be above suspicion. And I'm not sure that that organisation would hold up to much scrutiny around openness, transparency or accountability. Given their performance during this pandemic.
Yeah, that's definitely one for. We shall wait and see how that one plays out. But yeah, obviously we don't want for this to be a hypocritical set of circumstances where the CQC are wading in on people's culture when they're not in the best circumstances themselves. Hopefully, I can't remember exactly the circumstances, but whatever that consultancy advisory project that they were undertaking has had some positive benefits in that they're being steered in the right direction. But of course, only time will tell.
Indeed.
So, I mean, it seems, as far as I'm aware, at least, that a second spike is going to be inevitable. How do you think do you think the government has learned their lessons, basically? So obviously we've seen the devastating impact that discharging symptomatic patients into care homes can have. If we're going in for round two, yeah, how are you feeling about what if we're presented with a similar set of circumstances that we've had before? And hopefully it won't be bad, and obviously we'll be wiser. But how do you see that all playing out?
Well, I hope the government have learned lessons, but whatever the lessons the government have or haven't learned, the sector has learned a lot of lessons. And we know that, for example, it's really unfortunate if they try and put people who are untested into care homes. So I think we will get a much more robust response from care homes and much more kickback if people try to do that. Though, of course, there are the issues about occupancy and survival, which will also be in play there. I hope the government's learned lessons about, first of all, listening to the sector. I hope they've learned lessons about the importance of testing. I hope they've learned lessons that the local authorities are a failed mechanism and should not be the way in which you deliver extra money, because frankly it's completely wasted and it doesn't get to the front line. So I hope they've learned that lesson. I hope they've learned a lesson that the NHS is for everybody, and people in care homes should not be denied access to the NHS, which at the start of this pandemic they were. You know, we saw the NHS completely withdrawing from care homes. Interestingly to me, if you look at the population of care homes, pretty much all of them have so many comorbidities. And in that case, they should have all had letters from the NHS telling them to shield because of their medical conditions. And yet very few did. And that's an indicator that the NHS says to people who are in care homes, well, that's not our responsibility anymore. Well, let me tell them, it is their responsibility. They're legally required to deliver those services to citizens. So I hope that there's been a lesson learned about how you deliver support. I think there's also been a lesson about, for example, if you're not going to enable people to go into hospital, then what you've got to do is to bring some hospital services to where people are. So, you know, there was huge amounts of money spent on Nightingale hospitals and the development of new centres. And that was fine because we were expecting such a huge wave of people. But also we should remind ourselves that if those at most risk are not going to be able to go into hospital, we should think about how we use some resources to take hospital to them.
Yeah, definitely. And again, how do you see that playing out then? So what do you, I guess, where do you suspect that we will be kind of by the end of the year, and where do you hope that we will be before the end of the year? Because I guess there's probably a disconnect between those two worlds.
Well, I think there is a bit of disconnect, but I think what we've seen is as well that throughout the pandemic, there was a realization that the NHS needed to engage with social care much more effectively. We've had things like NHS Mail being rolled out really quickly to social care. So that's really speeded up the way in which information goes across systems. With the advent of winter, and of course there may well be a flu pandemic as well as a second spike of COVID, there will be a greater need for the NHS to work with care providers. What I think we need to also establish, though, is that doesn't have to go through the mechanism of a local authority. I would say to any health trust, any organisation out there, CCG, whatever, if you think you can engage in a direct relationship with your care providers, go ahead and broker the conversations. Don't think they have to be done via a local authority. Local authorities are very nervous of NHS directly involved with care because the NHS pay a much more realistic cost for care than local authorities do. Local authorities, and we saw it throughout this pandemic, did not like the NHS raining on their parade. And at the start of this pandemic, we tried to negotiate an agreed rate for people coming out of the hospital. And the people who scuppered that were the local authorities. Well, I think what the health providers need to know is that if they don't now work effectively with care providers, they'll just have very, very full hospitals.
Yeah, definitely. And we end up in a set of circumstances where we have hospitals on black alert with the bed blocking and just all the usual stuff that ends up happening in the health service, which will of course be far more acute if that ends up being the set of circumstances. So given everything that we've been talking about, what kind of things have you been doing? What types of conversations are you having with Care England members at the moment, relevant to the current state of play, if you like?
Well, I think what we've been trying to do is, first of all, give Care England members the information they need so that they're in the best position to meet this challenge. We've also been having conversations so that Care England members can tell us where the blocks and the challenges are, so we can take that up at a policy level, whether that's locally or whether it's nationally. We've also been having conversations with them about how they have practical support that can help them to deliver their services. So, for example, visiting and pods, for example, we've cascaded the opportunity for people to have pods in gardens, which will enable visiting. Those sorts of practical things we've pointed them in the direction of. We've also challenged when we've seen, for example, local authorities behaving badly around the allocation of money, and we've done a lot of that. We've also tried to challenge the fact that people with learning disabilities have been very much left out of this agenda, and it's really important that they are seen as part of this agenda of support, because of course lots of people with learning disabilities not only go out and about, but also go and visit their families, and we want to ensure that they're able to do that. Similarly, actually, a lot of people in older people's services often go out with their families. So we've been talking about how we can facilitate that safely. We've been also looking at the issues of PPE. And at the start of this pandemic, we had our supply lines disrupted by PPE going to the NHS. And then, of course, they began to realise that social care needed PPE as well. So we worked with the government on some of those PPE initiatives. We also worked on some of the stuff around, for example, the care badge, giving an identity to care workers. Because at the start of the pandemic, we saw care workers going to supermarkets and being turned away in the time when the NHS was allowed to shop. And we were very anxious that social care would be understood as an essential service, just as the NHS was. So we're doing quite a lot of work tangibly to do things like hand over the intellectual property of the care badge, but also then to talk to people like Asda, who are great, and other supermarket chains about ensuring that they enabled staff to shop in protected shopping times. So it's been a huge and very diverse conversation. It's been a two-way conversation with us hopefully trying to be helpful, but also listening to our members so that we really understood what the big issues were, and then we could set about trying to unblock them so that things were easier for care providers.
How do you think that providers are feeling about where we are today and what's in store for the future?
Well, I think care providers are understandably nervous about where we are. They're nervous on several levels. So they're nervous about whether or not we'll have a second wave, and they're nervous about how they'll be able to respond to that, particularly around staffing, resources, PPE. They're nervous about some of the longer term issues, which is how do they sustain their organisation when their income levels are significantly reduced. They're also concerned about some of the ways in which the system hasn't worked effectively with them. So they're worried about what the response will be in a second wave from the NHS, for example, and how they'll be able to access services that support their residents. So there are lots of different levels where I think care providers are apprehensive and worried, actually. And we have to do everything we can to try and minimise both the apprehension and also the worry about long-term survival.
Yeah, of course. And I mean, what are your expectations around just the kind of maybe the medium to kind of long term? How do you see this all playing out?
Well, I hope that what has been learnt from this pandemic is the absolutely essential importance of social care, and that it is a part of national infrastructure, just as the NHS is. And I hope that this will lead to a proper approach to long-term reform. And that needs to be reform right the way from a vision for social care, looking at how it's funded, looking at how it is staffed, how we support staff and teams to be effective, and how we remunerate them in a way that respects the level of work that they do. And I think there are some big issues there, but I really think as well, this is our opportunity to redefine social care. At the moment, social care is something which is a crisis intervention. And what we need to do is we need to tell the public that if you have good social care and if you have it at the right time, it can enable your independence and your quality of life. So I want to see social care integrated into the prevention agenda, the public health agenda, and seen as an essential part of all the work that society wants to do to make lives worth living. I also think the other area that is really important is, particularly now with the economy where it is, to recognise the absolute essential nature of social care to local economies. The people who work in social care in those local areas spend in local businesses, they live locally, and they are the people who sustain these local economies. And if you look at the MPs who the Prime Minister described as the constituencies that loaned him their vote at the election, a lot of those areas, social care is the biggest employer. And so we need to have the economic importance of this sector on the agenda, as well as what it delivers for citizens.
Yeah, without a shadow of a doubt. And of course, the saviours of this whole situation are, of course, the amazing care workers themselves. What can be done to help achieve greater recognition and appreciation for our fantastic care workforce?
Well, I think we've got to start with the money. The bottom line is this is a really complex, difficult, and emotionally as well as physically draining role. And also, we saw it throughout this pandemic. People are making literally life and death decisions exactly as they do in the NHS. And at the moment, they're regarded as wage staff, and what they need to be are salaried professionals, because that's exactly what they are. And when we've seen in this pandemic the way in which primary care completely withdrew from care homes, suddenly care home staff who were told for years that they weren't able to do X, Y, or Z, not only did it, but did it well. So in the future, I think this needs to be a platform around the reform of the social care workforce. What we need are some clear skills and competencies frameworks. These need to be aligned with the NHS, because in the future, we need staff that will move seamlessly between systems, exactly as social care service users do. We need to have a really good career escalator so that people know that this is a career they're entering. We need to have proper salary levels which recognise the complexity of the work people do, and also reward them for their commitment to training and quality and outcomes. So I think this has to be a paradigm shifting moment around how we support staff. And what staff need to know is the reason they need to be supported is because of how fantastic they are, and because they're providing an absolutely essential service. The recognition they deserve should be the recognition they get.
Can't think of a better way to wrap things up than that, Martin. Thank you so much. So a pleasure as always. Great having you on this week's episode of the Care Home Show.
Thanks very much.